because the exam is timed for 9 minutes. So this is 1624.
Right.
Can you see that on your end?
Yeah, I can see. Yeah, I can see exactly.
So
it's
you
9:24 on my end, but it's
yes.
the,
So
the right time.
you'd have 9 minutes. So 6 minutes plus 3, but we'll make it 4. Okay, so great. So I mean, you know the standard format of the exam. So you read the questions in 1 minute. So you've come in. So we start now. So the first question is, can you define acute diarrhea? So this is a station on surgical pathology.
Okay. Could you please repeat yourself? Define what?
What is your definition of acute diarrhea?
Acute diarrhea. Okay, it may be defined as the increased frequency of stools, or for more than 3 times per day, or increase in the or degree or loose stools over a period of 3 days.
Okay. Now, why is staphylococcal food poisoning often referred to as an intoxication?
All right, this is because staphylococcus, once it the food poisoning through staphylococcus is mediated via enterotoxin that is produced by the staphylococcus, not by actual infection of the gut mucosa by the staphylococcal organism. It is the enterotoxin that increases gut motility and causes diarrhea.
Okay. What do you understand by the term exotoxin?
Yes, was I audible, doctor? Do you
Yes.
hear me?
Well, yeah, I can hear you. Go ahead. What do you understand by the term exotoxin?
All right, exotoxin. Exotoxin is basically it is a toxic chemical substances that are produced by the microorganism and that are released by the microorganism, and they affect targets separate from the microorganism itself. This is in contrast to endotoxin, which is actually released when the microorganism itself it dies, and the cell wall or cell membrane ruptures, and the internal materials act as an endotoxin.
Okay, so please give an example of an organism which causes disease by the effect of an exotoxin.
Okay, for example, when staphylococcus causes food poisoning,
so
produces
another one.
What,
are there another one? So the question is, give an example of organisms that cause poisoning via exotoxin. So you've said staphylococcus, yes. Can you complete the answer?
Then enterotoxigenic E. coli that produces enterotoxins. Then Clostridial organisms produce toxins. These are a few that I remember. Bacillus cereus, they produce toxins.
What are the characteristics of Staph aureus?
Produces toxins.
What are the characteristics of a Staph aureus toxin episode of food poisoning?
Okay, the characteristics of staphylococcal mediated food poisoning, is that the question?
Yes.
All right. So since it is a toxin-mediated food poisoning, the signs and symptoms will appear rapidly after ingestion of the food. So this will be probably within 30 minutes within the first 24 hours of ingestion of the food. This will be followed by explosive diarrhea, and the diarrhea may go to such an extent that it will cause dehydration as well as electrolyte imbalance. But the diarrhea will not lead to what is it called? Gastroenteritic features, in the sense that the diarrhea will not be bloody diarrhea, there will not be mucus in the diarrhea, and it will not the patient will not have fever or signs of systemic inflammation.
Which bacterial exotoxin, also responsible for a severe and potentially fatal intoxication, has also found a range of uses in modern surgery?
So is it a botulinum toxin, Botox?
Okay, are you able to list some of the indication for which it is used?
Botulinum toxin acts as a muscle relaxant. So it is used
so the
commonly
question
or
is,
more
are
popularly
you able to
in
list
plastic
some
surgery.
of the indication for which it is used? Are you able to list some of the indication for which it is used?
It is used for decreasing wrinkles in cosmetic for the cosmetic purpose. It is used for relaxing the lower esophageal sphincter in case of achalasia cardia. It is also used to an extent for treating Hirschsprung disease. These are a few that I can recall so far.
Okay, the Clostridia are responsible for a diarrheal disease which have been the subject of much political and medial interest. Which particular organism is this?
Clostridium difficile.
Okay. Is the presence of C. difficile in the gut normal in adults and/or / children?
It is normal.
I didn't catch that.
It is not. It is a part of the normal flora. Yes, it is normal.
Can you elaborate?
Clostridium difficile, it is one of the organisms that is present as a part of the normal flora in the gastrointestinal tract, in addition to other organisms. But if there is an excessive antibiotic use, that antibiotics will kill off the other organisms. This will cause Clostridium to colonize the gut and start producing toxins, which will ultimately lead to a disease that is called pseudomembranous colitis.
What are the clinical presentation of C. difficile infection?
Abdominal pain, diarrhea, abdominal distension, dehydration, electrolyte imbalance, vomiting, nausea.
Okay. What 3 factors are commonly blamed for C. difficile infections?
The use of antibiotics, if the patient has undergone surgery, and it commonly occurs in the elderly age group, and elderly, immunocompromised, and diabetic age group. And hospital admission, being admitted in the hospital, hospitalization.
Okay, so I need to show you a picture and you let me know what you think that is, yeah? Is that okay?
Yes, sure. Yes, sure.
So I'm going to add a minute to your time.
Okay.
So tell me what you think this picture is. It's loading.
Have you shared your screen?
Yes, yes, okay. Yes. Can you see my screen? What do you think this is?
All right. So this is a colonoscopic image showing several an inflamed
what
colonic mucosa. This is looks like pseudomembranous colitis.
Okay. So we would carry on. So you've completed your time. You have 1 more minute left. Now, what is the composition of this pseudomembrane?
So pseudomembrane is basically the volcanic like eruptions of the colonic mucosa that contains the microorganisms, the Clostridium difficile, along with dead and dying neutrophils, as well as inflamed colonic mucosal cells.
Okay, so time is up. We would need to stop here, but I'm going to start with the feedback. So do you want me to run through? So you have 3 more questions to answer. What format? So let's quickly go through the responses. So the first question I asked you what is acute diarrhea? And your response was, so the answer we expect is, it should include reference to what risk tool. I think you did that, isn't it? Increased frequency, you did that. Greater than 3 times per day, you did that. And that's what 1 mark. So because this is your first time, I want you to have an idea of what the marking looks like. Why is staphylococcal food poisoning often referred to as an intoxication? Now, the answer should have something is due to ingestion of Staph aureus exotoxin rather than the organism itself, isn't it? So the toxin is secreted or excreted, if you like. What do you understand by the term exotoxin? So particularly, it should include reference to secretion of particular agent by the organism. Now, please give an example of which of these organisms secrete exotoxin. So you have Clostridium botulinum, Staph aureus, Staph pyrogenes, and many others. What are the characteristics of Staph aureus toxin episode of food poisoning? So, of course, rapid onset of ingestion, explosive diarrhea and vomiting, abdominal pain. It's usually of short duration. That's what. So everything so far is what? 1, 2, 2, 2. That's how many? 6 marks. Which bacterial exotoxin is also responsible for a severe and potentially fatal intoxication? And also, so that's botulinum, Clostridium botulinus, Botox, isn't it? So where is it used in? Hyperhidrosis, fissure in anus, strabismus, and cosmetic surgery. And that's what 2 marks as well. So here you have Clostridium. Clostridia is responsible for diarrhea disease. Which one in particular? C. difficile, 1 mark. Is the presence of C. difficile normal in the adult and child gut? So what we are looking for, because this is a standard, is that 3% of adults, yes, you can have it in as high as 66% of children under age 1. So that can boost but it's good to say, yes, it can be in a minority of adults and in children, yes. So now it's significantly higher in children. It's important to say that to get another, to get the full mark, which is 2 marks. What are the clinical presentations of Clostridium difficile? So its range of presentation, asymptomatic in neonate to mild diarrhea to severe watery diarrhea with pseudomembranous colitis, usually within 1 week of antibiotic treatment. That's what 1 mark. What 3 factors are commonly to blame for C. difficile infection? So yes, use of broad spectrum antibiotics, poor cleaning regimens, and spread by healthcare workers. So healthcare associated infection. So I showed you the image which you got. What is the composition of the pseudomembrane? It's a mixture of inflammatory cells, fibrin, and cellular debris from mucosa. So that's what 2 marks. So if you get the picture and you mention this, you get 2 marks. What are the key factors in the pathogenesis of C. difficile infection? You didn't answer this, and this is what 3 marks. What property of the organism makes it difficult to eradicate in a healthcare environment? That's what 1 mark. And what are the principles of managing a patient with C. difficile infection? That's what 1 mark. So that's 5 marks. So let's get what do you think of your performance?
Honestly, I think it's probably borderline or borderline average, or probably slightly below average. I'd like to know, since you have more experience regarding this, did I manage to pass this?
No, don't worry. Just tell me your opinion. We'll get to mine. So we're using Pendleton's feedback. So that's what you think. What do you think can be improved? What do you think you can
I think I improve in the sense that I
Okay,
think
no.
my answer should have been more
What do you
concise
think?
and specific.
Yeah, what do you think was good? So what do you think was good with your performance?
Um, I was able to identify the image, and I was able to specifically. So when they asked about which
Yeah,
organism
I think you had
causes life-threatening diarrhea,
knowledge in
food
broad
poisoning,
area.
that one, I guess only those two.
Okay. What do you think can be improved?
Well, first of all, time management. So it's crucial because I think bulk of the marks was in the last.
No, it's
There was a
okay.
5-mark
Time
question, then they
management.
missed 3
You've
marks.
identified time management. What next?
Then I think my answer should have been more to the point and more specific.
Okay,
So,
be
for
more
example,
concise. Yes, more concise. What else?
And I think I had some like couldn't see the clinical features as well.
So maybe knowledge gap.
Properly.
Knowledge
Yeah,
gap.
I need to probably brush up my knowledge on
Okay.
this pseudomembranous colitis.
Okay. Okay. Anything from you before you come to my feedback?
Because I wasn't expecting this station. Like I knew that pseudomembranous colitis is a very commonly asked question under surgical pathology. I was aware of that. So
No,
in fact,
just feedback. Just feedback. It's exam, is mock. We don't need, what you don't need is, don't worry about explanation. What more do you think? It's a practice, isn't it? You're supposed to practice and look at the area.
Yeah. So I theoretically speaking, I've learned this station quite a lot of times, but since I've been, this is the first time that I've been unexpectedly asked to come on a mock.
Let me teach you
I think that's what threw me off.
Ezra, listen to me.
Yes.
Let me teach you something new. Time for feedback is, don't worry, you need to just give the feedback.
Yes, yes.
So it's if you don't practice is really good. Sometimes it's good to even practice when you have other people around, because that's how tense the exam will be. Yeah. And
yes,
so
exactly,
any other feedback from you before I give my feedback?
Feedback regarding the section,
Yes.
or feedback regarding my
no,
performance?
So the Pendleton's feedback, you say what you think you did well, you've said that. What do you think you can improve? You've said time management, you said some knowledge gap, you've said being more concise. What else do you think you can improve?
I think my mode of delivery of the answers.
Okay.
I was answering in a questioning manner. So definitely I should, maintain that etiquette while answering. I think that's something.
Okay, that's all right. So so let's move to me.
That's all that I so far.
Okay, because I want us to do maybe one more station if possible. So I think overall, I think you had a fair amount of knowledge in the subject matter. I think your pace of answering is adequate. Yeah, so the pace is likely sufficient for the exam. And I think you were able to listen and pick the question. Your interpretation of the questioning was good. What do I think you can improve? I think you need to try and focus on answering the question. That's very important in the main exam. There's really hardly time for long explanation. So you want to answer, use the rule of 2 or 3. Any questions that you see that you're answering with more than 3 sentences, except it's specifically required, most likely are veering off and you're not getting any marks. So most times the examiners for the MRCS, they are not as fast as myself. Yeah, most of them are people in their early 60s, late 60s, early 70s. Few are in the mid 50s. So they are not they don't speak fast. So certainly time management. I felt if you had gotten to the end, you probably would have scored more marks. Certainly, of course, pass or fail would depend on performance of everybody else, but you want to scoop as many marks as possible. I think that's really largely what it is. What other knowledge station do you want to do again?